Hi, this is Dr. Mary Manis. I wanted to do a follow-up on our IPE number 4, how doctors deal with death. I want to thank our panel for the day, Mr. Laws, Drs. Jimenez, Walkley, Merrick, and Olaya, and Dr. Collins. Get comfortable with being uncomfortable was one of the things that we talked about. I think our panelists would like you to know to spend time with patients who are dying or who are trying to accept a terminal diagnosis. You have a lot to offer them and a lot to learn from them. Another point that they made, be there. Death is not a failure, it is the end of a life. Make sure you let your patients know that you are still there for them. Everything on earth has a beginning and an end. It's actually a unique and amazing opportunity to be able to spend either of those things with anyone else, especially as a physician. Be mindful was another point that they made. Stay in the moment when you talk with patients and their families about death. Your words and even just your presence can be very meaningful to them. Show them respect and regard and accept their words and behavior with grace and compassion. Embrace grief. Crying is okay. Humans cry when we're sad, and physicians are humans. But first, compartmentalize grief. Maintain focus and deal with urgent problems at hand. Then take time to feel your emotions. Equally important. Another point, have faith in a higher power, that you did your best, that things happen for a reason. Any or all of those things are helpful. Faith brings hope, and hope dispels despair. Reach out was a final point. Treasure your colleague friends and let them know when you need help. Then be there when they need you to help them too. Medicine is a rewarding profession in so many ways, but it can also be very difficult on body, mind, and spirit. Replenish yourself in healthy ways and be grateful for the opportunity to make a positive difference to people, including at the end of their lives. I had a question after the panel from a student. How do you and other physicians prevent getting desensitized to death? I had to think about it a long time, actually. I took a week, which is a long time to consider a student question, but it was a very good question, and I wanted to give it justice. And here's my answer. I don't think I have avoided it. I can't speak for other physicians, but I don't think I have avoided becoming desensitized to death. I don't think I wanted to. I have become desensitized to death because I have accepted it as the end of a life. I feel that our society has largely become overly sensitized to death, and we forget that it is inevitable, despite the best efforts of the best physicians with the best intentions. The more we try to avoid death and pretend it doesn't touch us, the less we value life as precious and tenuous and as a thing to be treasured and protected. What is to be avoided is depersonalizing death. Every life has value, and every death means something to someone. The value and meaningfulness of every death and every life is powerful to those who can appreciate it. It connects us to our own past and future, to other people, to our world, and maybe even beyond our world. It's one of the great mysteries of life, and I appreciate being able to give it as much time and thought as I have been able to as a physician. It's made me a better person, and it's allowed me to have more of the positive impact that I wanted to have, that brought me to medicine and has kept me practicing medicine for a very long time. I hope that helps. Doctors dealing with death is a huge topic, and there are a lot of resources out there that are helpful. But if I had one thing to tell anyone, it's just keep going. Keep doing your best, because that's all we have. And it's not about you. It's about your patient. Accept that, and you will be a happier physician. Thank you. Y'all take care.